Okay, let's talk about the wrist a little bit. With so many falls and skiers and snowboarders, the wrist joint is a common area of injury. Can you explain to us what some of the injuries are to the wrist that you see?
Well, the most common injury to the wrist would be a fracture of the distal radius. The radius is the major bone in the forearm that's attached to the wrist. When it breaks, it typically is pushed backwards away from the palm of the hand, and typically they'll have a deformity of the wrist. The wrist can be quite swollen and uncomfortable. Those will require a reduction. They're much more common in snowboarders than they are in skiers, and typically more common in our practice at the beginning of the season than at the end of the season, because they're more common in people who are learning. They occur more commonly in snowboarders because they don't carry poles, and if they're going to fall, they will fall either backwards or forwards. Typically, the most common way of injury is to fall backwards, put the hand out behind them, and as they fall, the wrist breaks. Again, a reduction and not infrequently surgery is indicated to put these back together so they can have a functional long-term wrist.
And to prevent those distal radius fractures, especially in snowboarders, it's really a good idea for them to wear wrist guards?
Wrist guards have been shown to decrease the severity of injuries to the wrist. And they haven't shown a decrease in the incidence of injury to the wrist, but definitely the severity. So we recommend to all snowboarders, particularly beginner snowboarders, that they use these wrist splints. It's a very inexpensive way of protecting the wrist. If you're wearing a wrist splint, you may decrease your severity to the point that you don't need something done surgically. You may have a wrist sprain or a mild fracture that doesn't require anything versus not wearing a splint. And